Hello, my name is Flora Ago. Today I'll be talking to you about diabetes and microvascular disease. So what is diabetes? Diabetes is a condition where there's a rise in the blood glucose level as a result of inadequate production of the hormone insulin, which is needed to regulate the glucose. Now, there are two types of diabetes. We could have type 1 and type 2. Type 1 diabetes has got an early onset, happens in children, young adults, and persons younger than 40 years. Management here is the administration of insulin, which means these persons have to be dependent on insulin for the rest of their life. Now, in type 2 diabetes, it's got an adult onset, happens in persons 40 years and above, can be managed with diet, exercise, lifestyle changes to include smoking cessation and alcohol reduction. Now, what are the signs and symptoms? These include increased thirst, increased urination, increased hunger, recurrent urinary tract infection, fatigue, tiredness, and also unexplained weight loss as can be seen in type 1 diabetes, and also weight gain or obesity as can be seen in type 2 diabetes. What are the complications that can arise from diabetes? Two things can happen: microvascular complications and macrovascular complications. When we talk about macrovascular complications, this include things like cerebrovascular accidents, which is the stroke, or the cardiovascular accident or cardiovascular disease, which includes the heart attacks. Now we're going to delve more on microvascular complications and disease. Now, microvascular disease simply means the affectation of the blood vessels, these tiny blood vessels in the organs of the body, and this can lead to things like failure in these organs. Like we've got nephropathy, which can be termed as kidney failure. We have retinopathy, which refers to the retinal detachment or eye problems, and also we've got neuropathy, which has to do with the nerve ending problems. Now, I'm gonna take this one after the other for clearer understanding. Nephropathy here, the kidneys are responsible for the removal of waste products from the body, and so when these kidneys begin to malfunction, then this is not achieved, okay? And this means that the body is not able to export waste product at this time, and so it can lead to accumulation of urea, accumulation of protein in the blood, and this needs to be checked by the clinician. That's when they ask you to do the estimated glomerular filtration rate, which is the EGFR, and also to do the ACR, which is the albumin creatinine ratio. You're also asked to do urinalysis to see if there's presence of protein in your urine. All of this is going to guide the clinician to give you the best diagnosis and also treat you as soon as possible. People who treat persons with this condition are known as the nephrologists, and they are the ones responsible for further management of this situation if you happen to fall in this category. Now, we're going to talk about the retinopathy. In retinopathy, the tiny blood vessels in the eyes begin to get swollen and irritated and lead to conditions like retinal detachments, and if this happens and not properly treated, then it can lead to blindness. Hence the reason why we say every diabetic should have an eye screening test done annually, and also to have this done on a professional level by seeing the ophthalmologist at least once a year. Now, if this is done, then complications as such can be avoided. Now, next condition, neuropathy. The diabetic patients are advised to do a daily check of their feet and be sure it is clean and dry, washed, clean. Also make sure they have the right size of shoes to wear at all times, or slippers to protect their feet from having any form of injury, because we know that in diabetes there's a delay in their healing process, and so this is advisable to tell your healthcare provider if you've noticed anything like sensation in your legs, or any form of injury, cut, bruise, and all of these things should be reported as soon as possible, so that you are referred to the neurologist who's going to continue with further management of this condition. Now, what happens when there's a good glycemic control? If you have a good glycemic control as a diabetic patient, then it means you can live a more healthy lifestyle. Okay, so now something I want you to take away from this lecture today is this: as a diabetic patient, you should monitor your blood glucose level and make sure that it is within the required range given to you by your healthcare provider. We believe in individualized care plan for all patients who are diabetics, and so monitor your blood pressure as well according to the American Diabetic Association, and also the NICE standard, which says that at least you should have a blood pressure reading of less than 130/80. Now, right, eating of nutritious and balanced diet with low carbs is advisable for diabetic patients. Now, talk about exercise. Exercise, at least taking a walk, 30 minutes walk a day is very good for persons who are diabetic, and also this is an advice given by the NICE guideline to follow for all diabetic patients. Lipid profile, checking your blood, checking all of this to help regular provider to do better diagnosis. Remember, it is advisable for all diabetic patients to follow this management. 1, make sure you have your blood glucose level under control, and also to be in a good glycemic state to avoid complications such as micro or macrovascular. Now, do your blood pressure checks and make sure it is within your target range of less than 130/80 millimeter of mercury. Now, make sure you do your urinalysis test according to what your healthcare provider has asked of you to do. Now, individualized care plans should be made for every diabetic patient who have been reviewed by the healthcare provider, and this is just so to give a target range which the individual has to work with to achieve a good glycemic control. Second is to monitor blood glucose level and make sure it is within the range as expected. Now, you do your blood pressure checks and make sure that it is within 130/80 millimole of mercury according to the NICE guidelines. And thirdly, I want to advise that every diabetic patient should have a food screening check annually, and also to do this routinely by yourself. Now, also diabetic patients are advised to do routine eye screening tests at least annually. Then also to check their HbA1c to confirm their glycemic state. Now, if all of these things are done, I believe that the diabetic patient has an opportunity to live a good lifestyle and to have a positive outcome. Thank you for listening.